Can you tell us what was your vision in organizing this meeting, and how does it bring new perspectives to the research landscape of the field?
We tried to do something different with this meeting and bring and trying to integrate epidemiology studies that are very strong in Brazil and South America with the advances in the molecular field, but in a way that we were looking to integrate these views, trying to understand better the complexity of tuberculosis and how to use information on complexity to improve our understanding about the determinants of the disease. So that's pretty much what the meeting is really about.
So what new research directions do you most look forward to hearing about at the meeting?
There are talks that describe new cellular populations that were ignored in TB, and now they're back, like eosinophils are there. And that brings a different aspect of the disease that we did not know, or we were not working on that. We have identification of new drugs. There were identified using artificial intelligence and other experimental systems that together now can increase efficacy of treatment of multi-drug resistant cases, for example. So we have advances in characterizing the disease, phenotypes and immune pathology, but also identification of new drug candidates, and also understanding how antibiotics and new drugs will work in the context of TB at the molecular level. I think those things, for me, are the most exciting advances that we will be discussing soon.
And can you expand a little bit more on how those molecular insights or even public health insights do lead to better treatment, more effective treatment, and hopefully ending the epidemic?
I think the most important advance that I can surely highlight is that we are understanding better the disease endotypes now, like really characterizing tuberculosis in every detail, the molecular detail that we can. And now when we put this and we overlay that with diabetes, other comorbidities, and age and sex, and now we can reveal aspects of the disease that were pretty much ignored in the last decades. So it's a very exciting moment in TB that we are literally uncovering new types of tuberculosis and how the disease is revealing to us to be far more complicated than we ever imagined. But at the same time, we have the tools to understand it better and to characterize better, and then identify paths that can be targets as therapies and vaccines. So, and this is all compiled into our meeting that we will have in a couple of weeks. Yeah.
Anything else you'd like our audience to know about the meeting, the field, or the journal?
So we are very excited to participate in this keystone and exchange ideas. I think the multidisciplinary nature of the meeting, it will be a high point. It will be a very important point of this meeting, and that will follow the journal's scope. So I think these two initiatives together, it's a win-win, and we hope to see many people there and like huge participation. And yeah, it's just I think it's a really important moment for the community, especially the TB community, to get together in a meeting that will be discussed. In the COVID will be discussed, implications of that. We have representatives from the WHO, from governments, and from academia. So I think it's an amazing forum to foster development of the field.